Hello, thanks for watching this video. My name is Sunil Garg. I'm the clinical lead for Trauma and Orthopedics department here at James Paget Hospital. The purpose of this video is just to make you understand a few bits and pieces about your upcoming joint replacement surgery. Essentially, the pathway begins with you being referred to us through your either physiotherapist or the GP. When you come to the hospital for the first time, we assess your joint and then advise you whether joint replacement surgery will be suitable for you or not. We discuss treatment options available to you, and then if we decide to put you on the waiting list, we then make you fill a well-being questionnaire, which is then sent to the consultant anaesthetist and the specialist nurses who make an assessment with regards to your suitability for the anesthetic. When you come into the hospital, we usually admit you on the day of operation, either in the morning or in the afternoon, and your typical length of stay in the hospital is about 3 days. It can sometimes vary and be about 2 days or even 1 day sometimes in specialist cases. Your journey is made very comfortable and safe and effective by high quality healthcare professionals that we have at James Paget Hospital. You will be meeting doctors, nurses, healthcare workers, physiotherapists, OTs, pharmacists, and a variety of other healthcare professionals who will be looking after you and delivering the best professional services to you. I hope that you have a very happy and comfortable and safe stay with us here at Paget. And if there are any questions, we all are available to answer any of these questions. We will now discuss some of the details of your stay in the last part of the video. Thank you.
Hi, my name's Zoe and I'm the sister of the pre-assessment clinic. You'll usually come to the pre-assessment clinic around 2 to 3 weeks before your surgery. During your appointment, you will be seen by a nurse, a doctor and an anaesthetist. This is to fully prepare you for your hospital stay and for your surgery. Please be aware that this appointment can take up to 3 hours. One of our nursing staff will usually see you first. They will ask you questions about your general health, about your previous surgical history, about your home situation and the support that you have. They will also ask you about any current medications you take, so please bring a current prescription with you. Your nurse will also give you your letter with the date of your surgery on it. They will explain about when to stop eating and drinking and when to drink a high carbohydrate drink that you have before your surgery. They will give you a body wash to use in the days leading up to your surgery, which helps to prevent wound infections in the days after your surgery. We also advise you about the medications that you may need to stop taking or change before your surgery, especially if you take medications to thin your blood or if you're diabetic. During your pre-op appointment, we measure your height, weight, blood pressure, pulse, oxygen levels and temperature. We also take MRSA swabs from your nose and groin to check for MRSA, which is a bug that can live on your skin without you knowing about it. You will also have a blood test and you may have an ECG within the department, and you may also need to go for an X-ray of the leg that you're having surgery on if it's been longer than 6 months since you had the last one. This is also a good opportunity for you to ask any questions you may have, so bring a list with you and ask your nurse at your appointment. We tell you a lot of information at pre-assessment, which we know can be overwhelming, but please feel free to ring the department if you have any questions or if you want us to explain anything again. After you've seen your nurse, you will see the doctor and the anaesthetist separately. They will talk to you about your surgery and about your anaesthetic and complete any documentation needed for your stay in hospital. You will also need to come back to pre-assessment clinic 3 days before your surgery in order to have a blood test, which is needed if you will require a blood transfusion, and to have your COVID screen. After your COVID screen, you then need to isolate for 3 days before your surgery, along with all the other members of your household. I hope that helps you understand a little bit about what we do in pre-assessment clinic, and we look forward to seeing you soon.
welcome to Ward 22. My name is Jill and I am the senior sister on Ward 22, and along with my colleague, Sister Caroline, you can recognise us by the navy blue uniforms. If you are watching this video, you are waiting to come in for a planned orthopaedic operation, normally a hip replacement, a knee or shoulder. We would like to welcome you to Ward 22, and this video is just to give you a little snapshot of what your journey will be when you come in for your operation.
Before Sister Jill shows you the ward, I would like to provide you with some information to prepare you for coming in for your joint replacement surgery. Please be aware that the ward that you're admitted onto may change depending on bed capacity at the time of your admission. However, your joint replacement journey, whilst in hospital, will still follow the same pathway. My name is Annabelle and I am one of the physiotherapists that you may see when you're admitted to hospital for your joint replacement. Before you come in for your surgery, it's really important to declutter your property so that you have clear access throughout your home. Please also consider if you have any trip hazards that you may want to remove. Please also consider stocking up any cupboards and your freezer so that you have plenty of food when you return home after your surgery. This is particularly important if you are someone that lives alone. Please think about where items are placed, ensuring that things are not too high or too low so that it is more comfortable for you to be able to access these things. If you are a main carer for a family member, you will need to arrange cover for at least 6 weeks after your surgery. Please try and liaise with family and friends or your local county council to arrange this, as this is not something the hospital will be able to help you with. If you have any steps into your property or any internal steps or stairs, if this is something you are struggling with already, please consider arranging grab rails or banister rails to be fitted, as this will be something that may help you after your surgery to make them a little bit easier to manage. One of the most important things to note is to ensure that you keep as active as possible up until your operation. Evidence shows that the more exercise you complete, the better outcomes that you will have after your surgery. It's really important to continue with any exercises that you already have. However, if you are someone that doesn't have any exercises, please consider completing some of the exercises that you're about to see in this video. We suggest trying to complete 10 of each exercise 3 to 4 times a day. These exercises will be provided to you in paper copy at your occupational therapy clinic appointment. So the first exercise, you need to hold onto your kitchen worktop or similar height solid surface, go up onto your tiptoes on both feet and lower back down to the floor. This is really important for your balance, but will also help to straighten your knee. The next exercise, you're going to stand on your good leg and practice lifting your leg that you're going to have your surgery on out to the side, ensuring that you keep your toes pointing forwards. This exercise will help you to strengthen your hip muscles, which stabilise your pelvis whilst walking. So the next exercise is particularly important if you are going to be having a knee replacement. You would stand on your good leg, keeping your back straight. Practice bending your painful knee by bringing your heel up towards your bottom. This is important to improve your knee bend, which will help with walking and going upstairs. The next exercise is particularly important if you're going to be having a hip replacement. Please stand on your good leg and practice taking the leg that you're going to have operated out behind you, keeping your knee straight and your toes pointing forward. This is important to help you push off when you are walking. This exercise, again standing on your good leg, practice lifting the leg up that you're going to have operated as if you were marching on the spot. This helps to strengthen the muscles that you need to complete steps and stairs. For the next exercise, you will need to sit on the edge of your bed or in a chair. Please attempt to straighten your knee out in front of you by lifting your foot off the floor and holding for up to 5 seconds if you're able to do so. Continue to practice even if you cannot lift your leg fully off the floor, as you are still working the muscles in your thigh. This exercise is important to strengthen those muscles which straighten your knee. This exercise should be completed sitting down, so practice sliding your foot back towards you as far as is comfortable to go. This will help with movement at your knee joint and will help you with walking and stairs, especially after your operation. Before coming into hospital, you will want to pack a bag of items to bring in with you. It is really important not to bring too many things, as you are going to only be in hospital for up to 3 days. Here is a list of things that you will need to bring in. They include appropriate footwear, which are flat and have backs, some day and night clothing, which are comfortable and loose fitting, medication in their original boxes, toiletries, entertainment such as your iPad, books, magazines, earplugs and an eye mask, as the hospital can be a busy environment and it might be noisier and lighter than you're used to at home. And all of the above, please bring in only a small bag. Please do not bring a large suitcase, as we do not have room to store large bags.
I'd like to give you the chance to meet some of the staff who will be looking after you while you're with us.
My name is Katie and I'm the ward clerk on Ward 22. I'm normally the first person you meet upon your arrival, and my job role is to keep the administration up to date.
My name is Julie, I'm a registered nurse. You'll be able to identify me by my pale blue uniform. I will be looking after you before and after your surgery.
Hello, my name is Nikki and I am one of the rehabilitation assistants. So my role is to help you be independent with your personal care and to encourage you with your exercises.
My name is Michelle. I'm a domestic for Ward 22 and I keep the ward clean. I, along with my colleagues, deliver you 7 cups of tea or coffee a day.
Hello, my name's Hayley. I'm a therapy assistant practitioner and I work alongside the physiotherapists and occupational therapists, and my role is to help enable you to get back on your feet and ready to get home with your recovery.
That was just a small selection of the staff that will be looking after you during your stay, and along with the consultants and the doctors, we work as a team to provide your treatment and care while you're in the James Paget. Your stay while on Ward 22 is 3 days, so if you come in on Monday, you will be discharged on Thursday. If you are well and you meet your therapy goals, you will be discharged before 3 days, and we have had people discharged on day 1 and day 2, and recently we discharged 2 patients on the day of their operation following joint surgery. So earlier discharge is becoming accepted practice in orthopaedic joint surgery. You are not coming into the James Paget for a long stay, so please make sure that your family, your next of kin, the friends, people who are supporting you on discharge are aware of this fact. If you have nobody to support you on discharge, can you please let the staff in pre-assessment know on your pre-assessment clinic appointment prior to coming in to hospital?
So to reiterate what Sister Jill has said, we will ensure that you have met your therapy goals before you go home. And these are listed on this bit of paper. So they are to be able to get in and out of bed independently and on and off a toilet and chair independently, be able to wash and dress independently, to be walking safely with an appropriate walking aid, be able to complete any steps and stairs that you have at home. Even though you may have completed all of the above, you will need to be made medically fit by your doctor and your nurse to be able to go home.
Hello, my name is Kelly Smith. I'd like to introduce you to theatres. I'm the theatre manager and we'd like to show you the pathway going through from ward into our theatre department and into the anaesthetic room. So today we'll leave Ward 22, we'll follow the corridor round to the first level at the front of the hospital opposite the lifts, and that's where the theatre department is. We'll walk into an area called the airlock, which is a double doors. And as you go through there, one set of doors will close, another set of doors will open, and then you'll be introduced into the department.
Hello, my name is Joel. I'm the support worker who is gonna escort one of our patients. But before that, I have a few questions to verify.
Hello?
Are you diabetic?
I'm not, no.
Are you asthmatic?
No.
Epileptic?
No.
Do you have any metal works?
I do not, no.
Do you have a marking on your
I
left
do,
hip?
yes.
Is it alright to have a look?
Yeah.
Yeah. Do you have stockings?
I do, yes.
Do you have any allergies?
No, I do not, no.
Your last lunch was yesterday at 10 p.m.
That's correct.
And your last drink was 5 o'clock in the morning
Correct,
today.
yeah.
Do you have any pacemaker?
I do not, no.
Can I just check your wristbands before we go?
Yeah,
We just
of course.
want to make sure we have the right patient for
Yeah,
the right
of course
operation.
I can.
Are you comfortable?
I
Do
am,
you want
yeah.
to sit up a little bit more?
I'm fine, thank you.
This is the theatre airlock as I explained. We'll now take you through the next set of doors, which will take you into our theatre department, where you'll see doctors, surgeons, equipment, and a lot of other people walking around.
Hello, this is Ben. It's your baby there.
This is the anaesthetic room with the operating table, and this is where the patient will lay down and get ready for surgery.
Okay. Sit down and then you can lay down here.
Yeah.
We're gonna cover you with this blanket.
So your support worker will arrive on the ward. They will ask you all your questions, and they will ask you if you would like to walk to theatre, or if you've got mobility restrictions, then they will push you on the bed. It's entirely up to you, that's your choice. They will see if you've been to the bathroom and if you want to do that before you come to theatre. Once you arrive into theatre, you'll go into the anaesthetic room. There you'll be greeted by an anaesthetist, an ODP, and a support worker who will met you on the ward and introduce themselves. Everyone will introduce themselves by their name. They will tell you who they are, what they're planning to do, and then they'll ask you the same questions again. And once they've done all the checks and they're happy and you're comfortable, and if you've got any questions to ask, you can ask the questions then. They will apply monitoring. You'll have blood pressure attached to your arm, ECG dots attached to your chest, and you'll have a pulse oximetry added to your finger. This is monitoring your heart rate, your blood pressure, and your saturation, your oxygen saturation, and that will be the whole time you have in surgery, and then once you arrive into recovery. So the choice then is what you've already discussed prior to coming to theatres, whether you have your spinal for your surgery or you're having a general anaesthetic, and everyone will get you ready and prepare you and talk you through which anaesthetic you've had. You'll then go into theatre, whether you're awake with light sedation or whether you're asleep, and there's a whole team in there waiting for you, ready, set up. Everything is sterile with the surgeon waiting for you to arrive so they can start surgery. Once your surgery has been completed, you'll be placed back onto your bed and you'll be brought into recovery, and this is the recovery area where a nurse or an ODP will look after you until you're ready to go back to the ward. So in here they'll make sure your pain is under control. You will have sickness medication if required. If you're able to, you can have sips of water, tea or coffee, and it depends how long you're with us. Sometimes you can be with us for half an hour, sometimes you can have an extended stay with us, and then we can provide you with sandwiches and biscuits and tea and coffee then.
On the first day of surgery, you will be out of bed, sitting in the chair, up and dressed, waiting for your physiotherapy session. And it is an expectation that you will work with us to achieve your therapy goals and improve your long-term outcomes for your joint.
Hello, my name is Melissa McGeary. I'm one of the senior physiotherapists who work on the elective orthopaedic orthopaedic ward. I work closely alongside the nursing staff and the other members of the therapy team. The day of your operation, when you return to the ward, the nursing staff will get you out of bed for the first time. You will use a rollator frame and may be able to walk as far as to the toilet. This can be as soon as 2 hours when you return to the ward. The day after your operation, we will teach you your exercises to strengthen your joint. You must continue these exercises on the ward and when you return home. We will progress your walking aid to either 1 or 2 sticks and teach any steps or stairs that you have at home.
Pain is an area that patients coming into the hospital for surgery are often worried about. You will have pain because you've had surgery, and we can't eradicate that, but we will, with medication, control your pain so that you can still function. It's important to remember 2 things about pain following surgery. One, that it is post-surgical pain and it will gradually diminish over the 6 weeks, so it will get better. And secondly, it's important that you take the painkillers that we give you so that you can persevere with your exercises despite the discomfort, because this will give you a better long-term outcome for your joint. When a doctor or a nurse tells you you can go home, that doesn't mean you can leave straight away, so please don't ring your family and get them to come and pick you up. When we are talking about discharge, a doctor has to do electronic typed letter for your GP, and he has to prescribe your medication. That has to go to pharmacy and be checked and then return to the ward. The nursing staff also have to check your wound and your general well-being, and there are leaflets that we have to give you about falls and preventing of blood clots and pressure ulcers and wound care information. And then also we have to explain your tablets to you or your relatives to ensure you understand them and can give them safely. All of this takes time, which I'm sure you appreciate. And on top of this, the staff that are involved in your discharge are dealing with other patients and issues and emergencies as well as your discharge. So we ask that you are patient with us. We know you want to go home. We want to get you home. We cannot always get you home as quick as you would like. So we ask for your patience, particularly at weekends when sometimes medications and the discharge summary can be done a little slower.
When you are home after hospital, you will need to keep walking regularly and increasing the distance that you complete on a daily basis. You can continue to do tasks around the house as much as you feel able to do so, and it is really important to continue with the exercises that the physiotherapist will have gone through with you in hospital. If you are having a hip replacement, evidence suggests that hip precautions are no longer necessary, and the current advice is to move as comfortable or as pain allows you to do so. Based on this, having an equipment arranged for you is no longer mandatory, but at your occupational therapy clinic appointment, they may decide that this is appropriate for you if your seating or furniture at home is too low, and it might just make things that little bit more easier and comfortable for you to be able to manage. If you are given equipment following your occupational therapy appointment, please ensure that you accept delivery of this, and please ensure that you do not return this prior to coming in for your operation. This is really, really important because you are going to need it after your operation. When you no longer feel you need it, please do not return it to the hospital or call the hospital. There will be a number on the leg of the equipment that you can contact to arrange pickup of the necessary equipment. The next few things are some practical elements about what you can and can't do and maybe how you should be doing it. In terms of driving, you must be in control of your vehicle to comply with the law. After a left joint replacement, it should be 6 weeks, and after a right joint replacement, it would be 8 weeks until you're able to drive. We advise you to let your insurance company know before you decide to do this. The next thing is about your personal care. We normally advise you to strip wash initially after discharge from hospital. This is to reduce the risk of falls or slips and also to protect your wound. If you have any further questions or queries, then please talk to the staff on the ward when you are admitted for your operation. In terms of sleeping, you can sleep on either side, but you might find it more comfortable to sleep with a pillow between your knees, and this might be something you want to try in hospital before discharge. With sexual activity, this is as comfortable and as you feel able to do so. In terms of working, this is normally something we advise you to discuss with your consultant, but expect to be off work for 3 months after your operation. In terms of getting dressed, you might find a long-handled shoehorn or a helping hand to be of benefit after your surgery. You might want to consider purchasing these before you come in for your operation to make things a little bit easier for you, especially if you are someone that lives alone. When you are discharged from hospital, you will be using a walking aid, and often people ask when they won't need to use a walking aid any longer. We advise you that when you are not limping, when your pain is under control, and you are moving about quite well, this is the point that you might be able to stop using your walking aid. If you have any questions, please check with your community physio, or if in doubt, you can always contact the ward and speak to a therapist there. But generally, like I said, if you're not limping, your pain is under control and you feel able to do so, then you can try and wean yourself off your walking aid yourself in your own time. Your therapist will talk to you about your ongoing rehab when they see you on the ward. Some patients, we might advise you to continue self-management after giving you prescribed exercises. Other people, if you have outstanding therapy goals, might warrant a referral onto the community physio team that is provided by East Coast Community Healthcare. We would emphasise that it is really important, as I've said before, to keep as active as possible, to do your exercises regularly, and increase your walking on a daily basis. To summarise, this is an elective surgery, so you will be required to manage your own personal care and get dressed in hospital as you do at home. You will be required to get out of bed the same day as your operation and potentially even be able to walk to the toilet. And you will be seen by a therapist on day 1, the day after your surgery. You will be expected to continue regularly with all the exercise you have been given. And like Sister Jill has said already, you will be in hospital for 3 days or less if you have met all your therapy goals and you are medically fit by the doctor. If you have an increase in swelling, pain or oozing from your wound that you are concerned about, please call the Orthopaedic Outpatient Clinic or A&E out of hours rather than going to your GP. These details will be provided to you with your discharge paperwork before you go home.
Finally, if you have any concerns or worries about your operation, please share them with us when you're admitted, because most of the time, by explanation of what is happening, we can put your fears to rest. We are here to help you get through your operation, get back on your feet and get home. Until we meet again, best wishes from Ward 22.